Who are you and what do you do?
I'm Jill McDermott and I'm a community children's nurse. I'm based at the Sunderland Royal Hospital, but we actually go out and about and see young people 0 to 18 within the community.
How can your service help me and other young people?
As I said, we look after 0 to 18-year-olds and sometimes 19-year-old young people who have often got complex health needs or some form of physical disability. Looking after children from 0 to 18 and sometimes 19-year-old young people, we can provide a service in the community that can deal with some of the complex health issues that some people have, and we can give that as direct care, or we can refer to local services such as GPs, but we tend to mainly work with the paediatrician from City Hospital Sunderland, and a lot of the care is directed by her. But we often have to teach and educate within the home so that parents are empowered to carry out that care, or even the young persons, if they're able to be able to carry out that care.
Yeah.
Dealing from feeding difficulties that some of the young people may have, physical difficulties they may have, breathing difficulties if they've had a breathing or a chest problem in the past. If there's seizures and they're difficult to manage, we can empower young people and parents to manage that at home. And our ultimate aim is to avoid young people having to come into hospital and keep them at home as long as possible.
At what age do I leave your service and where do I go?
Young people without additional needs can leave our service at 16 if they want to, and they want to go to adult services, but we generally tend to keep the children or the young people on our caseload up until the age of 18 or 19. And I would refer them directly through to the district nursing service, which is within adult services. But with transition starting a little bit earlier, I'm involved at the early point where we're talking about multidisciplinary meetings, so that the transition is a bit smoother from the health perspective.